Thank you, sir. I think it was a very useful presentation because you've gone through the literature, what are the different forms of red blood cells on which you can identify B12 deficiency and what are some of the studies related to it and the importance of homocysteine levels, high homocysteine levels as a marker of B12 deficiency. So now we will start with our panel discussion in which I have few questions for the panelists and then I will take also questions from the audience. So my first question is to Professor Dilaves. Sir, BMJ reported that 80% of the people, they might face the low back pain in some point in their time. And जब भी हमें low back pain होती है तो लोग उसको हमेशा associate कर देते हैं vitamin D deficiency से, vitamin B12 deficiency से, calcium की deficiency से. So, and then they insist कि जी मुझे injectable कोई लगाएं ताकि quick relief मिल जाए. So, what is the role of B12 injectable therapy in low back pain? And as compared to NSAIDs, how quick is the relief with this replacement therapy?
Thank you very much, Soumya. Methylcobalamin is one of the active form of vitamin B12, which directly participate in the homocysteine metabolism. As Professor Javed Akram and yourself has put emphasis on this homocysteine metabolism. And more researchers have showed that methylcobalamin is beneficial in neck pain, low back pain, diabetic neuropathic pain, neuralgia. The exact mechanism is poorly understood, but possibly methylcobalamin improves the nerve conduction velocity, promotes nerve regeneration, and it inhibits the ectopic spontaneous discharges from the primary sensory neurons in neuropathic pain states. As a vitamin, methylcobalamin may be very potential medicine for treating peripheral neuropathy with very good safety. A recent article is published in another journal, Nutrient Journal in 2020, again showed the same findings as yourself has narrated in degenerative orthopedic conditions with neurological compression. And most of the neck pain and back pain is either due to degenerative disc disease or degeneration of the facet joints. They have, it's a randomized control study in which in one group they have given hydroxycobalamin 1 milligram orally, and in other group they have combined nucleosides with methylcobalamin. And the patients were treated for 30 days and the end point was the VAS, visual analog score, and it was reduced within 30 days, reduced statistically significantly it has reduced. So it has a beneficial effect in degenerative conditions with some neurological compromise and in relieving pain as well. Thank you.
Neuropathy is the commonest cause. So obviously it is vitamin B कोई अमृत धारा नहीं है B12 के हर एक को एकदम. जब तक आप शुगर कंट्रोल नहीं करेंगे, सबसे पहली चीज़ है डायबिटीज मेटाबॉलिक कंट्रोल. As far as Dilaves very rightly said, there are compressive neuropathies and non-compressive, like coming out of the foramen, if there is a compression, carpal tunnel syndrome, things like that, then you must try to understand if there is structural problem which needs to be corrected. Vitamin B12, कोई भी दवाई अगर आप abuse करेंगे, it will lose, its market, and it will. So it has to be a rational use. What I have seen with vitamin B12, that a lot of people use it, but they also abuse it. So you have to understand कि ये कोई ऐसी दवाई नहीं है जो हर किस्म की न्यूरोपैथी, चाहे वो सिफिलिस की वजह से है, चाहे HIV की वजह से है, वो उसको ठीक कर देंगे. Usually you have to correct the basic, and अगर कोई structural problem है spine में, तो that needs to be fixed. अगर कोई compression हो रही है या compressive neuropathy है, तो it needs to be fixed.
Thank you. Dr. Imtiaz, taking this forward, I wanted to ask कि जो B12 है, it may recover the already damaged nerve, or if it can help in severe neuropathy due to hyperglycemia, and can it minimize the recurrence of neuropathy, B12 replacement?
Thank you, Soumya, for this question. I think definitely methicobal is a salt which is least discussed and most widely practiced salt, and by the most of our general practitioners. And previously, I was of view probably it has no role in management. It's just a kind of a placebo effect. What it was my thinking previously. But when I went through the literature, so we found that when we talk about especially the diabetic peripheral neuropathy, even the symptoms and the signs are present before the clinical overt diabetes in the pre-diabetic stage. So it means the damage has already been started in the pre-diabetic era. So, the question arises, should we intervene at this particular point or not? So with the passage of time, so this damage is keep going on. So you have ultimately the other symptoms like painful neuropathy and the dysfunction of the pseudomotor functions and the other problems with it, which are related with the diabetic neuropathy. Secondly, when we talk about the only thing how we can diagnose the peripheral neuropathy is one is invasive and what is a non-invasive. The non-invasive is widely practiced in the world, but we are not having now the conofocal microscopy, where we can directly see the nerve fibers. We can directly see the C-type nerve fibers on the cornea. Secondly, the gold standard of diagnosis is the punch biopsy. You know the biopsy, you can see the biopsy and later on the staining. So the question arises, can we start or should we start the vitamin B12 treatment at a very early stage or not, even at the stage of pre-diabetes? So this is a question for the panelists, for me as well. We have to answer this, because should we go very aggressively from the very beginning just to alleviate the symptoms? Secondly, we have definitely evidence, because previously I was thinking there is no evidence. The study, as Dr. Dailava has just mentioned, it was published in 2021 in the Nutrient. So they have the two groups. One is the active group, one is the non-active group. To the active group, they prescribed the full dose of methylcobalamin. To the second group, they gave the placebo. So at the end of the day, they found there was definitely improvement in the nerve conduction, and definitely there was improvement in the symptom as well. So they have the very solid evidence, so that it leads to the improvement at a very early stage. If you start this treatment at an early stage, so you can alleviate or you can convey the benefits of this medicine in addition to the whatever you prescribe regularly. Obviously, you cannot deny the role of pregabalin and the other salt as well. So it is the adjuvant therapy, it is not even sole therapy. We should admit this.
So this leads to my second question, since this is also related to diabetes and you are an expert on it, that metformin is still the gold standard for the treatment of diabetes. And we all know that metformin-induced vitamin D deficiency is also a known fact. So patients of diabetic neuropathy, who have established diabetic neuropathy, should we continue with metformin? Is there a dose adjustment needed, or should we replace it?
I think that this is a very varied question, and it is because recently we have found that metformin is related with the vitamin B12 deficiency. And you know the metformin is basically the cornerstone of the diabetes management. So if you take out the medicine out of your treatment plan, so obviously you are in trouble. Obviously you have to give more insulin, you have to readjust the different other oral agents. So definitely it is related because it impairs intestinal motility. We know it is the fact that because it leads to GI disturbance, it impairs that intestinal motility. So it is proposed that because this decreased or disturbed intestinal motility, it leads to the disturbed absorption of the vitamin B complex and intrinsic factor. So it can lead to. So, but this relationship is an inverse kind of relationship. So greater the dose of metformin you use, so less you will have the vitamin B12. So in my opinion, if you are prescribing, obviously you must go for the vitamin B12 level checked from the labs, and you must prescribe. If the patient is deficient having the deficiency of vitamin B12, so yes, you must give along with the metformin. But secondly, the other problem which we are facing practically, So my colleague with a gynae from the field of gynecology is there, because in the PCO, when the PCO patient they become pregnant, so the drug of choice we usually give the metformin. So we know the metformin, it crosses the placenta. So when it crosses the placenta, it leads to the disturbance, impairment in the fetal vitamin B12. So that lead to the slow for the fetus is affected, and it is shorter for the growth. And later on, because if you have the impaired growth in the intrauterine life, in the later life, in the adulthood, it can lead to the obesity and the type 2 diabetes. This relationship has already been established. So we must take this account into consideration.
Okay, thank you, sir. Coming on to another drug which is very notorious for causing decreased vitamin B12, that is the GI-related drugs like PPI and proton pump inhibitors, H2 receptor antagonists, antacids. They are also associated with vitamin B12 deficiency. So I would like to ask Professor Khalid Mahmood Khan, what is his experience and how would you manage this?
Thank you, Soumya. I think so. I will answer this question in two ways. As we all know, in Pakistan, acid peptic disease is too common. And one of the cornerstone of treatment for APD is the use of PPI. One thing that I have experienced in my patient, once patient start using PPI, इवन आप उसे कह भी दें कि अब आपको ज़रूरत नहीं है, वो एक हफ्ते के लिए बंद करेगा, दोबारा खुद से शुरू कर देता है. एंड व्हाट स्टडी हैज शोन, दो यूज ऑफ पीपीआई इज नॉट डायरेक्टली लिंक्ड विद B12 deficiency until unless you use these PPI for more than 2 years. Even then 3% के करीब उसमें deficiency reported है. The basic reason for B12 deficiency is the acid peptic disease. I think so because once there is parietal cell destruction, that may be due to acid peptic disease or one of the autoimmune condition in which autoimmune chronic gastritis or chronic active gastritis, that is both seropositive as well as seronegative. What I mean to say, seropositive, anti-parietal cell antibodies and anti-intrinsic cell. So intrinsic factor के against antibodies बन जाती है और similarly parietal cell, and that lead to destruction of parietal cell. As in your talk as well as Professor Javed Akram talk, कि once there is destruction of parietal cell, there is less hydrochloric acid that lead to एक क्लोराइड. और आप सबको पता है कि HCl जो है, जो हमारी खुराक के अंदर जो एनिमल बेस्ड डाइट, मेनली एनिमल बेस्ड डाइट जो है, उसके अंदर जो B12 है वो तब तक हमारे लिए काबिल कबूल नहीं है या काबिल इस्तेमाल नहीं है जब तक हमारे पास HCl नहीं है, एसिड नहीं है. सो एसिड जो है दैट रिलीज दी B12. और इंट्रिंसिक फैक्टर अगेन ज़रूरी है कि अगर इंट्रिंसिक फैक्टर की बाइंडिंग होगी तो उसमें से एब्जॉर्प्शन होगी. अब अगर इंट्रिंसिक फैक्टर भी नहीं है तो क्या होगा कि मोस्टली विल बी एक्सक्रीटेड इन द फीसिस. सो दैट्स वाई जो आपने चिलिंग टेस्ट की बात की, हमारे मोस्टली PGR सिटिंग है इन द ऑडियंस, तो उनके लिए ज़रूरी है कि चिलिंग टेस्ट को अगेन परफॉर्म करने का एक तरीका ये है. बिफोर एम्बार्किंग टू चिलिंग टेस्ट में एक और चीज़, एग्जाम में मोस्टली एक सवाल पूछ लिया जाता है, व्हाट आर द कॉमन काज ऑफ B12 डेफिशिएंसी. डू यू नो एनी पैरासाइट? तो मोस्टली हमारे जो PGR है इवन और फाइनल ईयर स्टूडेंट वो साइलेंट होते हैं इस क्वेश्चन पे, क्योंकि उन्होंने 4th ईयर में पैरासाइटोलॉजी पढ़ी होती है, उसके बाद उसको फॉलो. सो वो डाइफाइलोबैक्टीरियम लेटम जो फिश टेप वर्म डाइफाइलोबैक्टीरियम जो बिगेस्ट या लॉन्गेस्ट पैरासाइट है इन ह्यूमन बॉडी, 30 फीट लेंथ होती है इसकी तकरीबन. सो उसकी जब ग्रोथ हो जाती है बॉडी के अंदर दैट लीड टू, क्योंकि वो बॉडी के साथ जो हम खा रहे हैं वो सारा फिश टेपवर्म खा जाता है। और फिश टेपवर्म कहाँ से आता है? जो आप फ्रेश वाटर की फ़िश लेते हैं, अगर वो अंडर कुक्ड है तो उससे हमारे जिस्म में उसकी सिस्ट आ जाती है, एंड दैट लीड टू डेफिशिएंसी ऑफ B12। एंड अदर एच पेलोरी की आपने बात की, अगेन दैट इज रिलेटेड विद एसिड पेप्टिक कि अगर आप एच पेलोरी रेडिकेशन थेरेपी देंगे फॉर 2 वीक तो APD जो है वो रिजॉल्व होगी और उससे आप B12 डेफिशिएंसी को ख़त्म करने का आपको मौका मिलेगा। सो मैं शिलिंग टेस्ट पे आऊँगा, वो दैट इज़ फॉर स्टूडेंट, वो आप सबको पता होना चाहिए, एग्ज़ाम ओरिएंटेड है, मे बी आपसे वैसे ना पूछा जाए, लेकिन एग्ज़ाम में आपसे शिलिंग टेस्ट तो उसमें आपने रेडियो एक्टिव B12 ओरली लेना है, पेशेंट को देना है, एंड आफ्टर 1 आवर यू हैव टू गिव मेथिकबाल और whatsoever the preparation you have IM after 1 hour। और यूरिन में if more than 10% है तो आप समझें कि आपकी एब्जॉर्प्शन ठीक हो रही है, B12 की एब्जॉर्प्शन ठीक हो रही है। अब अगर इंट्रिंसिक फैक्टर डेफिशिएंसी को आपने रूल आउट करना है तो आपने वो रेडियो एक्टिव के साथ इंट्रिंसिक फैक्टर को ओरली कंबाइन कर देते हैं। सिमिलरली इफ़ यू वांट टू रूल आउट पैंक्रियाटिक डेफिशिएंसी तो पैंक्रियाटिक एंजाइम लाइक पेप्जाइम है या इस तरह के एंजाइम अलॉन्ग विद रेडियो एक्टिव देते हैं। वो जो पहले 2 फैक्टर वो वैसे ही रहेंगे, रेडियो एक्टिव एंड इंट्रामस्कुलर injection of B12। And lastly, if you are suspecting bacterial overgrowth, then you have to perform this test after 2 weeks of antibiotic therapy. So with that, I think so I have answered most of the...
Thank you very much, sir. That was a very useful tip, Viva tip for the residents. Dr. Shaila, so when we talk about anemia and anemia in pregnancy, so खुद ही से लोगों का ये assumption होती है कि ये आयरन डेफिशिएंसी, आयरन की टैबलेट शुरू कर देते हैं। सो आई वांटेड टू आस्क यू, हाउ कॉमन डू यू फाइंड विटामिन B12 डेफिशिएंसी और मेगालोब्लास्टिक एनीमिया इन योर क्लिनिकल practice, especially in pregnant population, and how do you address it?
Much for asking the question, and I would be happy to answer. This is in fact a very common misunderstanding. Iron deficiency can alter many metabolic pathways in the body. उससे क्या होता है, फॉलिक एसिड इफेक्ट हो जाता है, विटामिन B12 इफेक्ट हो जाता है, लिपिड मेटाबॉलिज्म इफेक्ट हो जाता है। ऑन द अदर हैंड विटामिन B12 जो है वो RBC की फॉर्मेशन के लिए बहुत ज़रूरी है। तो दोनों इस तरह से इंटरडिपेंडेंट हैं कि अगर हमें आयरन की डेफिशिएंसी है तो B12 इफेक्ट हो गया, और B12 की डेफिशिएंसी है तो आयरन इफेक्ट हो गया। अब हमारे पास सोर्स क्या है? हम ये देखते हैं कि हमारे पास सोर्स विटामिन B12 का एनिमल प्रोटीन है, जिसमें कि हम पोल्ट्री, फिश, मटन वगैरह से लेते हैं। इसके अलावा जो सोर्स है वो है हम सप्लीमेंट्स की फॉर्म में लेते हैं। इसके अलावा फोर्टिफाइड फूड भी हैं। तो हमारे गायनी में, ऑब्स्टेटिक्स में जितने भी मरीज़ हैं उनको ना सिर्फ हम सप्लीमेंट्स एडवाइस करते हैं, साथ हम उनको फोर्टिफाइड फूड भी अगर एडवाइस करें तो इस तरह से बहुत सारी चीज़ें कॉमनली बोथ प्रॉब्लम्स कैन बी ओवरकम, एंड द कम्युनिटी बर्डन एज फार एज मॉर्बिडिटी एंड मोर्टेलिटी इज़ कंसर्न वो भी केटर हो सकता है।
मैम, जब हम प्रेगनेंसी की बात करते हैं तो 2-3 सप्लीमेंट्स हैं विच आर कॉमनली एसोसिएटेड इन ट्रीटमेंट ऑफ प्रेग्नेंट फीमेल्स के कैल्शियम ज़रूर देना है, फॉलिक एसिड देना है, आयरन देना है। हाउ फ्रीक्वेंट डू यू प्रिस्क्राइब विटामिन B12 टू प्रेग्नेंट फीमेल्स, एंड डज इट हैव एनी रोल इन द ऑर्गेनोजेनेसिस ऑफ फीटस, और इफ इट्स डेफिशिएंसी कैन कॉज सम प्रॉब्लम्स?
एक्चुअली विटामिन B12 का बहुत इंपॉर्टेंट रोल है। सबसे प्रेगनेंसी का जो एक क्रिटिकल पीरियड है वो फर्स्ट 4 to 6 वीक्स ऑफ प्रेगनेंसी है। ये वो पीरियड होता है जिसके अंदर न्यूरल ट्यूब की डेवलपमेंट हो रही होती है। न्यूरल ट्यूब की डेवलपमेंट के लिए जो न्यूट्रिएंट्स चाहिए वो अगर वहाँ पर मौजूद नहीं है तो न्यूरल ट्यूब के डेवलपमेंट में प्रॉब्लम आ जाती है, विच कैन लीड टू न्यूरल ट्यूब डिफेक्ट्स। और न्यूरल ट्यूब डिफेक्ट्स ऐसे हैं जिनको कि अगर इनिशियल पीरियड में हम कैटर कर लें तो हम बहुत सारे लेटर ऑन प्रॉब्लम से बच सकते हैं। लेटर ऑन प्रॉब्लम्स हमें क्या हो सकते हैं कि एक ब्रेन की डेवलपमेंट प्रॉपर ना हो, स्पाइनल कॉर्ड की डेवलपमेंट प्रॉपर ना हो, स्कल की डेवलपमेंट प्रॉपर ना हो, एनकेफेली, स्पाइना बाइफिडा हो सकता है। तो ये सारी वो प्रॉब्लम्स हैं विच कैन लीड टू न्यूरल प्रॉब्लम्स, और इनको हम कैटर कर सकते हैं अगर हम फर्स्ट 4 to 6 वीक्स ऑफ प्रेगनेंसी के अंदर adequate dose of folic acid and vitamin B12 जो requirement है patient की दे, तो we can cater for these problems. So it is essential to keep in mind the time of advising the medication.
Okay, thank you, ma'am. Professor Dilaves, I would like to ask कि जो न्यूरोपैथीज हैं उनके साथ बहुत एसोसिएटेड है B12 डेफिशिएंसी और न्यूरोपैथी का रिलेशन. सो जो न्यूरोपैथीज ट्रॉमा की वजह से कोई न्यूरोपैथी हुई है उसमें भी, या फिजिकल ट्रॉमा के साथ एसोसिएटेड जो नर्व पेन्स है उसमें भी कोई विटामिन B12 का रोल है?
Thank you, Soumya. Yes, it has an important role because vitamin B12 is important in the synthesis of fatty acids which form the protein myelin. And as all of us know, myelin provides a sheath coverage for the neurons, for the nerve fibers. And if the myelin sheath is disrupted or not formed properly, this leads to slowing of the conduction velocity, slow the regeneration following the nerve injury. And we have seen here another very good example because distant integration of the myelin sheath lead to multiple sclerosis. There's a lot of research going on this. And it has beneficial role in nerve injuries, but it depends upon the severity of the nerve injury and it depends upon the severity of the compression neuropathy. If the nerve is gone altogether, only vitamin B12 will not help. If there is a neuroparaxia, yes, it will help. And if this is a neuropathy, it will help. But if there is a compression is very severe and the conduction velocity is slowed and all the action potential are lowered, then you may have to release the compression as well in addition to the vitamin B12. Thank you.
And same goes for sciatic nerve, sciatica pain, vitamin B12. Sir, आपसे sciatic
Yes, yes, and it's the same mechanism in sciatica as well. Because sciatica is a radicular pain due to the prolapsed disc. When the sciatic nerve, one of the component of the sciatic nerve is get caught in by the disc or in the neural foramina. It's basically a compression neuropathy. And if the compression is severe, you have to relieve the compression. But majority, more than 80% of the patients who come with the sciatica due to degenerative disc do not require surgery. They get better with conservative management. And in conservative management, methylcobalamin has a very important role in addition to pregabalin and NSAIDs. But if there is a severe pressure, if there is a severe compression, then they require, but this is only from 10 to 15% patients who do require surgery, but the majority will do better with conservative management of a month or 2 months.
Okay. Professor Imtiaz, मैं आपसे ये पूछना चाही थी कि in a diabetic patient there are some tests that we routinely do. Like we do an HbA1c, we look at the lipids of the patient, we look at the urea and creatinine levels and urine for microalbuminuria. So how important it is to check the vitamin B12 levels in patients of diabetes, and should it be corrected only if there is deficiency of the levels, or should it be given to all patients taking metformin?
This question is very valid. I think the confusion arises. I was about to ask this same kind of query from Dr. Javed Akmal in his own experience. Because is it necessary that you treat every person who is a diabetic and having symptomatic diabetic painful neuropathy, you go with along with this standard care of treatment like your pregabalin or gabapentin, thing like this, or whatever you are prescribing. So as a adjuvant therapy, should you go for this methylcobal along with it? So because it helps in, as Dr. Dilaves just mentioned, in the regeneration of the nerves. But one thing is very, very important, which we are forgetting, is that we are focusing more on the vitamin B12. Definitely there is a role of vitamin B1 and B6 as well. So it's a combination of vitamin B1, B6 and B12. So both of the three of this triaca, it would help in the regeneration of the nerves. So the question again, it remains here, should we go along with as a adjuvant therapy in every patient who is having painful diabetic neuropathy? My answer, as far as my personal experience is concerned, is yes, I would like to go with that. because obviously you have the underlying nerve damage is there, and you are because pregabalin is not going to repair the nerve.
Yes.
It has no, because it is just to give you the symptomatic relief of the pain. So we need a treatment which will help in the regeneration of the nerves. And so in adjuvant, as adjuvant therapy, so we must need a treatment with like just methylcobalamin, vitamin B12, vitamin B1 and B6 as well. Because the both of three vitamins, the series of these vitamin B, they help in regeneration of the nerves.
Professor Javed Akram, your expert comments on this. Your expert comments on this, that should we check vitamin B12 levels and only then replace it, or in diabetic patients with neuropathy we should go ahead with B12 replacement?
I think if you are in the habit of getting the B12, I think there is something. Okay. If you are in the habit of getting B12 done of all diabetics, I think it's going to be very, very expensive. Most of our patients are unable to afford it. And if you get it from 3 different labs, which I have this much data in my computer, they are all different, and they are different, wide apart. So the best thing is, which is much cheaper, is the best homocysteine level. And if the homocysteine is high, then you can go ahead and treat with B12. But as I said, vitamin B12 given parenteral is much, much better. Maybe don't over treat it, no need to give it every day, or every week will be more than enough, or even sometimes, as I said, it will be very expensive to do vitamin B12 testing on all the diabetics, because diabetes is, half of our practices are full of diabetics. So I think the best thing will be to get the homocysteine level, which is much cheaper, and also if it is raised, you can go ahead and treat with B12 and monitor the homocysteine rather than, because homocysteine is the risk factor for vascular disease, not only for nerves. That needs treatment in any case, as I mentioned in my small talk. Also, the lab-to-lab variability of vitamin D in Pakistan is huge. So it's not really that much reliable. What I will say that my question is vitamin B12 for how long? It will depend upon the condition. If you are dealing with pernicious anemia, it's a lifelong treatment. The moment you give it up, it's going to go. Again, I will emphasize that vitamin D has a wide spectrum of uses because of its metabolic activity, enzymatic production, pancreatic enzyme production, lipase, amylase. It has a crucial role. But then again, this is a vitamin which is more, unfortunately, abused than used. So one must stick to good clinical practices, and this is not the ultimate treatment for diabetes, diabetic neuropathy. Pregabalin or something like that is only recommended for people with painful neuropathies, because very soon the painful neuropathy gives way to painless neuropathy, and even if there is a something poking out in the shoe, people do not know, and then they keep on injuring themselves. So that is why I think it will depend upon the patient, and it will vary from the patient to patient, but you must diagnose why you are using methylcobal and mecobalamin before you just prescribe it to everybody. Because then whatever the drug is, I'm sure the companies, Hilton being an ethical company, will also promote ethical use rather than unethical, because methylcobal is also being used by quacks a lot. They are injecting right, left and center to everybody. So obviously we have to differentiate ourselves from this, especially in this August gathering. We have to give a targeted therapy, and also in the good clinical practice, you must know the indication why you are giving it and the doses.
So is there any harm of very high levels of vitamin B12?
I don't think there is any harm at all that I know of, but again, there are no toxic levels that we have explained. There are low levels of vitamin B12, but there are no toxic levels like in vitamin D. I personally, because I have done a lot of research on vitamin D, I personally think I have never ever seen a case of vitamin D toxicity. So I don't bother about the toxicity. And with vitamin B12, there is no harmful effect if you overdose it. You don't need to worry about it. But there is also, it will cost, so there is no need to do that.
डॉक्टर खालिद, आई वुड लाइक टू आस्क कि बहुत सारे पेशेंट्स होते हैं जिनकी कोई गैस्ट्रिक सर्जरी हुई हुई है या बेरियाट्रिक सर्जरी हुई हुई है फॉर ओबेसिटी. सो इज देयर अ रोल ऑफ गिविंग विटामिन B12 इन इंजेक्टेबल फॉर्म टू सच काइंड ऑफ पेशेंट पॉपुलेशन?
Dr. Somia, thank you very much. This is very important question in those patients where gastrectomy or eyelid resection or bariatric surgery to as a. So I think so there we need to give injectable B12 rather than oral B12 because once there is gastrectomy, so we may have deficiency of intrinsic factor as well as parietal cell deficiency. So हमारे पास वो दोनों तरह से कमी. Or if there is ileal resection, as you know, absorption of B12 is at the level of ileum. So again, once there is no absorption, तो अगर हम orally गोलियां ले भी रहे हैं, तो वो कोई helpful नहीं है.
Okay. Dr. Shaila, is there any association between B12 deficiency and infertility? Because that is another issue which very frequently comes to you.
Yes, definitely. When the vitamin B12 level is low, it definitely can cause subfertility. But if there are prolonged period of deficiency and it is not corrected properly, then it can lead to other deficiencies in the body leading to compromised fertility status. All those patients who have these problems, they can have problems at two levels. Number one, because of the deficient or you can say less than standard ovulation. The follicle releases the egg which is not of that quality and size which is required for fertilization. Secondly, the fertilized egg has low capacity for implantation. When the implantation is affected, that leads to sometimes is early implantation, but that implanted fertilized egg is again destroyed and that is called blighted ovum. So whenever there are deficiencies in the body stores at different levels, it can definitely compromise the fertility status of a female, and all those females who are getting the treatment for infertility, if we add vitamin B12 to their treatments, we can get better results, in fact very rapid positive results as far as infertility treatment is concerned.
Okay, thank you very much. Professor Javed Akram, another very important question that malaise, fatigue, general weakness is also associated with B12 deficiency. And then there is a condition called fibromyalgia, which is a diagnosis of exclusion. So is there any role of B12 deficiency in fibromyalgia?
I think a very, very good question because these are very, very common symptoms of so many deficiencies and so many diseases. We as diagnosticians must try to diagnose why is the fatigue, and it could be vitamin B12, it could be vitamin D, it could be thyroid, it could be, many other depression, which is very, very common, especially in our females. So I think the best thing would be to go it. I will not go straight away for every malaise and aches and pains for B12 level. I'll go for blood complete level. And if the MCV is high, mean corpuscular volume is high, and if I see large macrocytic cells, then I would definitely consider giving folic acid and B12. If the patient is not affording, if the patient is very well affording, because as you know, we see loads of patients in, mashallah, next door, Aapka clinic, where the patient cannot afford all these tests. So what we do is, especially for my general practice colleagues sitting here, if they do blood complete, which is usually they do it in their own lab, and if they see macrocytic anemia, it is much better to give B12 and folic acid, because folic acid also is a very important component. If you give alone vitamin B12, usually they develop folic acid deficiency later on. So it's best to give both and then repeat blood complete. And the MCV and the cell size becomes smaller and also better stained. So that's a very easy thing to do. Otherwise, you will have to really go for the reason why the malaise, why all this ill health is, because this affects quality of life. But unless you diagnose what it is, there is no point in treating these.
Okay, thank you. Dr. Khalid, there is a question. I think आपने partly answer कर दिया है, लेकिन reiterate कर दें उसको कि उन्होंने कहा है कि अगर terminal ileum completely dissect हो गई हुई है, terminal ileum completely उसको remove कर दिया हुआ है surgery से, ये complete dissection है उसकी. So would giving vitamin B12 be helpful, and in which form it should be given, oral or IV, and should it be given for whole life?
I have already answered this question that B12 is primarily absorbed in ileum. So once there is ileum dissection, so absorption side तो आपने ख़त्म कर दी. So better to give IM injection or IV injection. So यहाँ एक चीज़ और मैं clear कर दूँ कि हमारे यहाँ एक concept ये है कि हर कोई injection लगवा रहा है. They are not that useful. WHO का report के मुताबिक if you take more than 10 injections for any reason, the incidence of Hep B, hepatitis C and HIV is on rise due to misuse or जो भी आप इसे कह लें यदि ताकत के टीके लगवा लें तो प्लीज़ वहाँ पे इन टीकों का कोई रोल नहीं. बट इन दोज पेशेंट जहाँ पे आइलिड रिसेक्शन है, yes we need to give these injectable. सिर्फ एक बात इसके अलावा मैं कर दूँ कि हमारे पास वार्ड में अक्सर पेशेंट एडमिटेड होते हैं पैनसाइटोपेनिया के साथ. So I think so before going for bone marrow biopsy हमें उनका B12 लेवल करवा लेना चाहिए. Many a time even MCV is normal. Even MCV is normal. There may be B12 deficiency. So in those cases if there is आपकी B12 deficiency उसको आप correct करेंगे तो pancytopenia may be corrected. Thank you.
Thank you.
With your
Sir,
kind permission.
जी जी.
My question
Mic sir on करें.
My question to Dr. Khalid or Dr. Javed was because nowadays the metabolic surgeries, obviously many of the people, the patient, they're having it. So where you place that, would you like to give this vitamin B12 as an injectable therapy or as an oral therapy? Where do you place the role of vitamin B12 in these patients?
Again, bariatric surgery is a general term. It depends, you do raw and loop, or you do gastrectomy, partial gastrectomy, and what do you do? If you do partial gastrectomy, usually there is enough stomach left to produce vitamin D. So parietal cells, and usually unless you have done combination of both and have developed the derangement in the gut microbiota, because gut microbiota is again a problem after surgery, then the best thing is, if somebody can afford the bariatric surgery, he can afford serum B12 level. So best is to do B12 at 6 weeks, and then if they require, then supplement it. Khalid, you want to add?
Sir ने rightly उसका आंसर कर दिया है कि इन बैरिएट्रिक सर्जरी अब उसकी भी डिफरेंट हैं टाइप्स. एक तो सर ने जैसे गैस्ट्रेक्टमी है और इंटेस्टाइनल सेक्शन है. सो B12 नॉर्मली अगर हम देखें तो हमारी जो डेली रिक्वायरमेंट है दैट इज़ टू लेस. आई थिंक सो इट इज़ अराउंड 3 माइक्रोग्राम. जो हमारा RDA है दैट इज़ ओनली 3 माइक्रोग्राम. सो इवन डेफिशिएंसी होते होते कई दफ़ा 2 साल लग जाएंगे. सो इफ़ यू हैव एनफ स्टोर, बट आई थिंक सो कि इफ़ समवन हैज़ गॉन फॉर सर्जरी एंड पेशेंट उस वक्त फिर मेरे ख्याल B12 लेवल करवा लें, और उस पर डिपेंड करता है कि उसको कब आपने रिप्लेसमेंट देनी है, कि मे बी पेशेंट में रिक्वायर अर्लियर रिप्लेसमेंट.
ओके कुछ क्वेश्चंस हैं ऑडियंस के क्वेश्चंस मेरे पास वैसे लोड्स ऑफ क्वेश्चंस हैं बट कुछ हम जो रिपीट कर रहे हैं इन्फॉर्मेशन वो मैं स्किप कर दूंगी एक क्वेश्चन जैसे अभी इन्होंने आलिया ने पूछा कि व्हाट इज़ दी सोर्स इलियास अंजुम ने सॉरी व्हाट आर द डेली फूड्स रिचेस्ट इन B12 सो ऑलरेडी बताया था कि जो पोल्ट्री है मीट है फिश एग्स fortified cereal and dairy products they are the rich source of vitamin B12 सेकेंडली एक और क्वेश्चन है न्यूरोपैथी से रिलेटेड है वो डिटेल में डॉक्टर दिलवाइज नदीम ने आपको बता दिया है कि कैसे रीजनरेशन में भी हेल्प करती है और क्या देना है हेयर लॉस और माउथ अल्सर्स से कोई एसोसिएशन है B12 का और रिप्लेसमेंट से कोई फ़र्क पड़ता है एनीवन
I think the aphthous ulcers or the mouth ulcers are very common with vitamin C deficiency as well. And as we all know, the vitamin C and B, they are both water soluble and they can coexist fairly commonly. But aphthous ulcers usually are not specific to any disease at all. They can occur without any disease if they are aphthous ulcers. Of course, if an ulcer in the mouth persists for a very long time, non-healing ulcer must be biopsied.
अच्छा सर एक क्वेश्चन है कि इज़ मिकोबोलामीन लाइट सेंसिटिव और कितनी देर में ये पीक करता है ब्लड में और इसको कितनी ड्यूरेशन के लिए देना चाहिए लाइट सेंसिटिव है टैबलेट
समझ नहीं आ रही
लाइट सेंसिटिव है टैबलेट मिकोबोलामीन
इसको मेरा ख्याल है vitamin B12
लाइट सेंसिटिव है मिकोबोलामीन की टैबलेट लाइट
I think so, yes, or this drug should be taken in the morning with food or after food.
And in how much time you can achieve the levels of vitamin B12 in blood after replacement?
I think so, once if there is no deficiency of intrinsic factor and B, जो आपके parietal cell normally work कर रहे हैं, तो ये within 1 hour absorption हो जाती है एंड पेशेंट को उसमें कोई ऐसा कोई है नहीं है ऐसा इशू
Okay. So another question is, what is the preferable route for vitamin B12, oral or IV?
No, I already said again and again it's parenteral because oral vitamin B12 absorption is not that good. At the most, 40 to 80% is not absorbed, especially if the underlying problems are pernicious anemia and things like that. So the best route is intramuscular, but no need to give it twice a day or once a day. You can, in the beginning, you can give it on alternate days, and then you can switch to once a week or once in 2 weeks also.
Okay. Another question is, what is the role of vitamin B12 in thyroid patients? Thyroid disorders.
I don't think so. There is any relationship with it, particularly direct relationship with the thyroid disease. So they have not mentioned the hypothyroid, the hyperthyroid, or the Hashimoto-thyroiditis, whatever.
Okay. Is there any relationship between vitamin B12 deficiency and growth of the children? So is it important? Dr. Shaila से मैं पूछ रही हूँ.
Has a definite role for the growth of the children. If a child is born to a mother who is already deficient in vitamin B12 levels or stores, then that child is born with a deficiency. And that deficiency leads to stunted growth, that leads to iron deficiency, that leads to muscle weakness, that leads to neurological problems. So child can have multiple problems which that child has already gotten from the mother. So it is very important to replete the stores as well as the levels of the pregnant patient when she is passing through the phase of the pregnancy. Because in our population, most of the patients, when they enter into pregnancy, the inter-pregnancy interval is very less. They are grand multiparas. They can have multiple pregnancies. They can have twins, triplets, quadruplets, and already compromised stores. So this is all a recipe for deficiency which can lead to compromised growth in a child.
Dr. Imtiaz, आपके लिए क्वेश्चन है कि what is the relationship between the dose of metformin and B12 deficiency? Is this dose dependent deficiency?
So this is because I just mentioned there is inverse relationship between the dose of metformin and the vitamin B12 deficiency. So larger the dose of metformin you are using, the less you will have the vitamin B12 in your body. So obviously we have to look at, because previously this matter was totally neglected, and this is the first time that we, because metformin is, I just mentioned, is a cornerstone of the diabetes management. So definitely we must be careful about the use of metformin, while we must be, as I just because it's a very learning thing from Dr. Javed Akram, because homocysteine, just check the price is quite low, because indirectly you measure the vitamin B12 instead of checking the vitamin B12 directly. So definitely there is a relationship of vitamin B12 deficiency and increased dose of metformin. So this is again food for thought, that while using it during the pregnancy, because we are using lot of metformin during the pregnancy as well. We must be careful about that, and I think Dr. Shaila is better person to answer that, how often the problem is. Because when you're using the metformin during the first trimester, in the patient with the PCO particularly, and you are using along with insulin, so definitely it crosses the placenta, and it crosses, so it is going to affect the vitamin B12 metabolism in the fetus.
Definitely, yes. You have already answered the question. It can affect the fetal status badly. So it is very important that if we are prescribing metformin or insulin, especially in the earlier trimester, we have to compensate for the deficiencies parallelly. Otherwise, later on, because in third trimester of pregnancy, because of hemodilution, the status already goes down. So if it is not corrected, it can lead to even preterm birth and other birth complications.
प्रोफेसर दिलावेज, जरा डिफरेंट सा क्वेश्चन है कि जो टॉर्निकोइट अप्लाई करने की वजह से कोई न्यूरोपैथी होती है, टॉर्निकोइट अप्लाई करने से उसमें कोई B12 का रोल है? Pressure,
Yes, the more the tourniquet pressure is, the more damage to the nerves. And as stated previously, yes, it do have a role in tourniquet palsies if there is a neurological damage, and most of these cases there is a neurological damage. But I cannot quote any studies because tourniquet palsies are not very common. We now use the digital tourniquets, all the pressures are checked, monitored, and the timing of the tourniquet is also monitored. We do not see it. So I do not have any scientific studies to say that. But in tourniquet palsy, there will be nerve palsies as well. Secondary to the vascular insult, the major component of the tourniquet palsy is the vascular insult, the fibrosis of the muscles. And yes, it can help. We can try it. That's what I'll say. Okay. Thank you.
प्रोफेसर जावेद अकरम, ये स्पेसिफिकली आपको एड्रेस्ड है कि व्हाट इज द डिफरेंस बिटवीन ओवल माइक्रोसाइटोसिस एंड राउंड माइक्रोसाइटोसिस, मैक्रो सॉरी, ओवल एंड राउंड.
Yeah, before that I'll just comment on what Dilawal just said. Vitamin B12 deficiency is one of the causes of non-compressive myelopathy. And also to some extent, if you're dealing with a cord lesion, and if you have a compression, you'll have to relieve that compression. Otherwise, the patient will get irreparable damage to the cord. So if you are dealing with a non-compressive myelopathy, then you can consider one cause is vitamin B12 deficiency, which is fairly common in the white people. And it is reversible by replacement of vitamin B12. As far as the oval cells and the rounded large cells are concerned, macrocytosis, you have to, there are many causes of macrocytosis. There could be underlying malignancies which could be causing. There could be, usually the oval macrocytes, they are more of a feature of some underlying disease. If you have purely rounded, like I showed, the ringlets, the ring type cells, then they are very typical or pathognomic of either vitamin B12 or folic acid deficiency. So it's one of the two. Oval cells usually mean that the bone marrow, there is something wrong with that, maybe megaloblastic bone marrow because of some underlying malignancy, then you must go for bone marrow testing. Otherwise, usually we can avoid bone marrow aspiration if you have typical rounded macrocytes.
Okay, there are a lot of questions, but because of shortage of time, I will just take this last question and then we will wrap up the session. All the panelists will join you for lunch. You can ask your questions if there are any queries which have not been answered at the lunch. The last question is open for anyone. Is there any dose reduction required in B12 in dialysis patients? Dose reduction required in patients on dialysis?
I don't think so.
Vitamin B12 exogenously is a dialyzable drug. If you are giving vitamin D, then you better give it after the dialysis rather than before the dialysis. But dialysis itself causes a lot of anemias and things like that, but not vitamin B12 deficiency as a whole. But if you're giving exogenous, because it's a water-soluble vitamin, you can have deficiency and it will go through the dialysis fluid.
Is there any role in major depressive disorders of vitamin B12? Depression.
I think so. If there is deficiency, we should give because it leads to dementia. If there is deficiency of B12, so I think so we should give B12 in those patients. And similarly, as it is water soluble, I think so in dialysis patient, yes, it can be given. सॉरी आपकी समझ ही नहीं, हमें इधर से सुनने में समझ नहीं लगती कि बोलना क्या जा रहा है. साउंड सिस्टम इज सो बैड कि हम इधर में एक दूसरे की बात सुनने में.
Okay, I think we will wrap up the session here. Thank you very much for a very interactive discussion. I'm very glad that there were so many questions. If there are still any queries which are unanswered, I apologize for not taking them on the floor because of shortage of time. I'm really thankful to all the esteemed panelists for sparing time and updating our knowledge on this very important aspect of different medical conditions associated with B12 deficiency.